Hello friends. So November is celebrated as Cancer Awareness Month, and today we will talk about lung cancer. In my previous video, I have already discussed about the risk factors of lung cancer and how pollution and cigarette smoking are important determinants or risk factors for causing this disease. Now, when there are symptoms of lung cancer, or even for people where there are no symptoms, it can be detected early with the help of some imaging modalities like CT scan. For heavy smokers, it is recommended that a low dose CT scan be done at regular intervals to pick up these lesions in the lung. Once these lesions are picked up, usually a biopsy is required to understand whether these lesions are cancerous or not. A PET CT scan is required to know whether the disease has spread elsewhere in the body or it is just limited to that part of the lung. Once we know that the disease is limited to that part, the further treatment depends on the fitness of the patient. Most of the times, the treatment offered to disease that is limited to the lung and has not spread anywhere else is in the form of surgery, which is complete removal of the lesion along with some normal tissues of the lung. After surgery, the further treatment would depend on what was the size of the lesion, were there nodes involved, or other features in the histopathology report. Sometimes it is there in the patients that the patient is not fit for a surgery, the lung is not so fit, or there are some cardiac conditions because of which surgery is not an advisable option. In such cases, these lesions can be treated with only radiation, a very high dose radiation, which we usually call SBRT, stereotactic body radiation therapy, where a very high dose radiation is targeted at the lesion in the lung, and the radiation is completed in 3 or 5 sittings. This radiation is highly precise with minimal side effects because it focuses exactly on that area, and very less radiation is received by the surrounding normal tissues. The results are almost equivalent to what we achieve with surgery, and if the disease is small and there are no nodes involved, then the patient is usually followed up after this treatment. Stay aware, stay empowered. Thank you.